Hello, everyone. My name is Mohammed, and I'm a PhD student at Eurecom, which is an engineering school in the south of France. And alongside our colleagues from Corney University, we'll be presenting Coronacheck, which is a system we built in order to fact-check coronavirus claims. So it's no surprise that with recent days, there has been an impeccable amount of fake news surging through the web, specifically through coronavirus. And this is due to the fact that recent advances in AI has made it very easy to generate false news. Add to that the fact that spreading news is very straightforward through social media. And the amount of false news has actually scaled up to the extent that manual fact-checking cannot cope to it. So we ask if there is some way in order to automate this process and try to help fact-checkers in their verification pipeline. So can AI somehow offer a helping hand in order to deal with this problem? And the answer is luckily yes. There has been a line of research which is called automated fact-checking. And the idea here is to use recent advances in AI in order to debunk false information. And there have been many efforts in this line of work. And one of these efforts is our system, Coronacheck. So Coronacheck is a system that is used to verify statistical coronavirus claims. So in the image you see here is a snippet of the website where we input a statistical claim. The death rate in Italy is much higher than in France. And a statistical claim is any claim that can be verified using either a number of confirmed cases, death cases, recovered cases, or any other statistic related to coronavirus. So in this sentence, we want to verify it. We need to compute the death rate for Italy and then compare it with that of France. So this is an example of a statistical claim. An example of a non-statistical claim is something like this. So Paper Cube's COVID-19 is not a statistical claim. We actually try to integrate some of these non-statistical claims in our system as we saw many users trying to verify them. So what does our system offer? Well, number one, it's explainability. So when we verify a certain claim, we don't only say whether it's true or false, we actually include some more information. So we tell you that you have to look in this table, you have to look at this row and this column, and you'll get the values. And we get all our tables from Johns Hopkins University, where they try to integrate coronavirus data and update them daily. On the other hand, we offer a little bit of ambiguity resolution. So if you have a look at this sentence, the death rate in US is higher than in Germany in September. The term death rate is actually a bit ambiguous because it can be interpreted in multiple ways. So you can either consider it as death rate with respect to the population, which is what we saw here, or you can actually consider it with death with respect to the total confirmed cases. And this is unfortunately a huge problem due to the ambiguity of the language, and we try to resolve this as much as possible. So I'm going to do a quick walkthrough with the system. So the system starts by inputting a certain claim. So US death rate is 1.3% in March. Now, to make sure that the user inputs a statistical claim, we actually have a classifier which detects if the claim is statistical or not. If it is, then we have to predict 4 properties from this input claim. So, for example, we try to predict what tables we use. So you can see here that we want to compute the death rate. So we need to find what are the number of deaths and the number of confirmed cases. The time, as you see, is explicitly stated here. So the time, same thing goes for the country, so USA. And then for the formula, and this is basically a division because death rate, we need to divide 2 numbers. And what we want to do is we have our claim, which is 0.013, and given a trustworthy database, which contains updated coronavirus statistics, we want to see if, given these predicted properties, we can find a certain query that, if executed on this database, gives us an answer very close to the claim in question. So our system has been, since its deployment from March of last year, there have been more than 24,000 queries, more than 15,000 visitors, and we till now support 7 languages. And thanks to the IFCN grant, we have actually updated the system a lot. So number one, we updated the system by using state-of-the-art deep learning models, namely transformer-based language models. We added more structured data sets, which included more information related to incidence rate and active cases. We added support for multiple sentences and multiple languages. And we don't actually have a classifier for every language, but we have one classifier for all languages together. We integrated non-statistical claims in the system, and this is done by basically matching the input to a table of pre-fact-checked non-statistical claims. And finally, we added multiple interpretation for ambiguous claims, for example, the one related to death rate. So before we go demo the system, I think it's really important to try to share what lessons we learned during the building of the system. So number one, it's expect anything from the user. So at the beginning, we didn't actually employ a statistical classifier, but we found out that it's really important because users tend to input a lot of invalid claims, and we need to have this classifier in order to do a sanity check on the input. And number two, the data coming from the user is actually valuable because actually had a look, we logged everything, and we had a look at the data, and we updated the system accordingly to what the users interacted with. Number two, the second lesson, which is important, is that language is hard. So even using state-of-the-art models, there are still some aspects related to language that cannot be easily solved, and one of them is ambiguity. So there are many claims which are really ambiguous, and ambiguity is very relative and not trivial to define. So dealing with these kinds of claims is actually very difficult. Finally, the last lesson I want to share is that ML is not for everything. So it's not always practical to use machine learning in every scenario. For example, for predicting the country or the time, having a simple rule-based approach actually suffices because a model would be training a certain model would be an overkill. At that, models or machine learning approaches in general are very data-driven. So you're only as good as the data you have in hand, and this is not always the case. So we're gonna go now to the website and do a quick demo. So this is the interface of the website where you have languages here, and you type your claim here, click on check, and you get the output. So I'm gonna first start with a non-statistical claim. So I am attending Global Fact 8. And we see that the system says that this is not a statistical claim. And it points us to our examples which are statistical. So to put a statistical claim, we can say that there are 50 new cases in France on the 12th of September. And you see here how I explicitly stated the country, the time, and this points to the data set. And you can see that according to this interpretation, the statement is false. And we show here all the predictions coming from the system. And in more details, we actually give the confidences of the classifiers for the example and an explanation written in English. Now, what happens if we remove the time from the sentence? This is where multiple interpretations start to kick in. And here we provide interpretations not only on day level, but on a monthly level. So here we do more interpretations, and if we actually remove the word new here, we actually get more interpretations because you have 2 for the month, but also 2 for the table, since you can either have new confirmed cases from this sentence, or you can actually think about it as total confirmed cases. Finally, to get, so here we have 4 interpretations, but we can push this even more and remove the country. So in this scenario, we did not include the country, and our system would actually, if the location was not defined, it actually either outputs the statistics related to the world in general, so the entire world, or it would include the statistics for the country where the user is residing. So for me, I'm residing in France, so I should get statistics for France. And we see here 8 different interpretations. So to end, I think it's valuable to talk about some open problems we found out when developing the system. So number 1, again, it's the ambiguity problem, since language actually conceals multiple interpretations for the same sentence. And ambiguity is very relative and not trivial to define. So one problem is, how do we deal with this? The other problem is that of data integration. So now we're using data set coming from Johns Hopkins University. But what if we get multiple data sets? How do we combine them and aggregate them in a way which makes the system much more efficient? And this is a very difficult problem to do, even with state-of-the-art tools. A shout out goes to the team which helped develop the system. So alongside my advisor, Paulo, and our colleagues, Emmanuel and George from Cornell, we actually built the first version of the system, which was applied to another use case. And then we implemented it on the Corona setting, thanks to our student, Yusuf, who was responsible for developing all the front end and back end of the system. I thank you for your time. And in this slide, I put some entries in the system which deserve to be on the last slide. Thanks again for watching the talk. And if you have any questions, I will be looking forward to them. Thank you.
Hello, my name is David Corney. I'm a data scientist at Full Fact, and I'm going to talk to you today about automating claim verification to support fact checkers. So fact checking is a very specialist job. It's a form of journalism and requires skilled people. I don't believe that AI or any other software is going to replace fact checkers anytime soon. However, automation such as AI can help with a variety of tasks within fact checking, such as media monitoring and claim detection, finding things worth checking. It can also help with claim verification. This is the process of deciding whether a claim is fundamentally true or false. So for example, given the claim inflation rose to 2.1% last month, the highest in 2 years, either that claim is true or is false. To automate this process, we do need some form of machine-readable data, such as National Statistics Institute, which can provide us with data that a computer can read directly. And then given some simple and explicit, often numerical claims, it is then possible to automatically verify whether these are true or false. So it won't help very much with claims that are technically true but misleading or half true, and nor will it help with very complex or ambiguous claims. Here we still need expert fact checkers to do the work. But there are some simple ones where we can get software to help us out. And so at the moment, I'm going to demonstrate a prototype that we've been working on at Full Fact earlier this year, called the Robo-Checker. This takes sentences from digital newspapers in the UK and from Hansard, the parliamentary reports. It then attempts to extract the core meaning of each sentence in a systematic way. And where possible, it then verifies the values in the claim against the Office of National Statistics, the UK's main authority on stats. And then it forms a similar comparison to see whether the numbers in the claim match the numbers provided by the ONS. Currently, the model only works in English, and currently it's limited to work on certain macroeconomic topics, such as unemployment and inflation. Though we do hope to expand those things in the near future. So this is our current demonstration version. This is a temporary interface to the RoboChecker for purposes of demonstration. And in the top left box up here, we can type in any text, such as a sentence found in a newspaper. And then after we submit this, the process will, within a second or two, show how it has interpreted the sentence and whether it thinks it's true or false. And here are some examples just to save you typing. So the first example, the unemployment rate was 4.9% in January. We submit that. After a moment, the system comes back and says, true, the unemployment rate for January 2021 was 5.0. So two things to come to notice on this one. The first thing to see is that the system output has said January 2021, even though the input just said January. So the system is telling you that it assumes that the year is 2021 when it's doing the verification, which is good to know. And secondly, that 4.9 is not actually the same as 5. We allow a certain tolerance because generally speaking, small errors are typically rounding errors or not really worth checking. So second example here, unemployment recently fell to 4.8%. This time there's no mention of a date at all. It just says recently, but the system says most recently available data is 4.73, which is close enough to what the claim says. So again, the system says true. So far, so good. Let's try another one. In this case, Gordon Brown, the former Prime Minister, is making a prediction about the impact of COVID. And of course, we cannot know the future. So the system just replies, unable to check predictions. A somewhat complex example here discusses the inflation calculations by the ONS. And again, the system says correctly April 2021. Again, it is inferring the year is 1.6, as the sentence says. Inflation rose from February to April. There's no values given here at all. But the system still correctly works out that in February 2021, the value is 0.7, shown in the top right corner. And by the end of that period, in April 2021, it was 1.6. And this is an upward trend, and therefore the claim is true. And in contrast, if I say inflation rose from January to February, the system says false, actually it was going down from 0.9 to 0.7. So at this point, you may be thinking that I'm just cherry picking examples to make sure the system looks good. And of course I am. So here's an example of it not working so well. If you try GDP fell 5% last year, the system just says GDP is an invalid topic. So far we haven't talked about GDP. So it fails on that one. And going back to this more complex sentence earlier on, although it did give the correct answer around inflation being 1.6% in April, it totally ignores the fact that the sentence also mentions inflation in February. So if I change the sentence here to say inflation was, something crazy, that 100% inflation in February, the system still says it's true because it's ignoring that part of the sentence. So there's still work to be done. So I hope that demo gave you some flavor of what the system can currently do. What's next? We are planning to expand the coverage of prototype to do more topics such as GDP, as well as to do more robust sentence handling, including cases when there are more than one claim in one sentence. And also looking at internationalization, particularly adding in multiple languages beyond just English. All this will take time to do, but we are planning to do this work over coming months. Also, I mentioned the interface I showed you is only a temporary interface for purposes of demonstrations. We still have to decide exactly how to implement a new tool created with this technology at its core. So one option would be to produce a daily list of checked claims the fact checkers could then look at and decide which ones are actually worth digging into manually. Alternative is during a live debate to feed the transcript of a debate from TV or radio into this kind of system and perhaps flag up in real time to fact checkers or even to interviewers or when someone says something that is arguably false. So in a moment, I'm going to give a bit more technical details about how the system works and how we developed it. If that's not interesting to you, then thank you for listening so far. And please do get in touch with any questions through email or Twitter as you prefer. If you're still here, this is going to be slightly more technical, although not very technical. But first of all, I want to describe a little bit more about how the system doesn't work. So a few years ago now, we started to develop a different form of robo-checking tool, which built on much more formal linguistic methods. Basically, the software built a dependency parse tree of each sentence being analyzed, and then we searched over that to find the head of the verb, head of the sentence, and the dependent clauses from that to identify the key parts of the sentence. And so the source code mixed up linguistic concepts like subordinating, conjunction, and adverbial modifier, along with economics and fact-checking concepts, and became very brittle. It's also, the whole thing was very language specific. It only ever worked in English and would be very, very hard to make work in other languages. Then a couple of years ago now, of course, the BERT model was published, and large language models were shown to be very, very effective at a variety of linguistic tasks. So we started again. And this example shows, I think, our current motivation, the way we're currently working. So given a sentence like, interest rates were raised by the Bank of England to 1% because of the recent jump in inflation, we can process this partly from a purely linguistic perspective, by which I mean we can identify things like interest rates is a topic of the sentence, inflation is a different topic, and the 1% refers to interest rates and not inflation. This is just based on the grammatical structure of the sentence. We can see the bottom example there, the jump relates to inflation, but there's no particular value given. And that's all just linguistics. On the other hand, we also have what we call a business logic, which is knowledge such as interest rates meaning the base rate of the Bank of England. That the word inflation means CPI, the consumer price index. Also knowing where the current rate of the Bank of England is stored on that particular URL. And so the current system is designed to separate out these two parts of the process. So the linguistic logic is handled by a BERT model as far as possible, which is inherently multilingual and very, very good at doing NLP. Whereas the business logic then is left to us to implement directly in our source code. And this is inspired by the way that smart assistants like Alexa and Siri work, and particularly the ATIS flight booking tools, which takes queries around airports and airplanes, and does a process called simultaneous intent detection and slot filling. In our case, intent detection means saying, what is the claim we're trying to check? And slot filling is one of the parameters defining that claim. Of course, the BERT model does require some training data, though it seems not a huge amount is required. We're currently using a mixture of manual and automatically tagged words within each sentence of our training set, using Spatie to identify entities such as dates and numbers, all of which can be made multilingual very easily, we hope. And the business logic code dealing with macroeconomics and fact-checking is mostly language independent. So sadly, we don't have a robot that can just read the papers and tell us what's true and what's not. What we do have is an exciting prototype that can automatically spot at least some false claims. So thank you for listening, and if you do have any questions, please do get in touch.
Hi, my name is Renzer. I am a project manager at Code for Africa, which incubates PesaCheck, one of Africa's leading fact-checking organizations. And today I'll be exploring media accessibility with you and helping you understand how you can make your fact checks more accessible to disabled users using multimedia like caption video and audio. So we'll be looking at a definition of digital accessibility, examples of inaccessibility so that you know what not to do, how you can make your fact checks more accessible, as well as free tools and resources that you can use to achieve greater accessibility. I'm a visually impaired communications professional. I've worked in media for 10 years, and I am part of Code for Africa's engagement team, and my pronouns are they, them, and theirs. So what is digital accessibility? Digital accessibility refers to the accessibility of devices, products, and environments to all people. There is a misconception that accessibility only benefits disabled users, but there are many cases of accessibility features being beneficial for the entire digital ecosystem. So for example, caption video is not just useful for deaf audiences who can't hear what's in the video, but it's also useful for users who, for example, use their devices muted, or who are consuming that media in a place that's noisy or where they can't play that audio out loud. The captions help them get value out of that content. So that's an example of accessibility serving everyone. And here are many examples of inaccessibility. I'll just go through a few of them. And I think the first one is the most important for this session. Inaccessibility can be content without captions, transcripts, or alternative text. So captions, like I've mentioned earlier, is when you add text descriptions to a video to help users who can't hear the audio know what's happening. That's an example of an accessibility feature, and lacking captions is making your content inaccessible to users. It's also important to have transcripts for videos or audio for the benefit of users who prefer consuming that content through text. And alternative text is text descriptions for images on your website or the images that you upload on social media for the benefit of users who use assistive technologies like screen readers. Alternative text helps them understand what's in your image. So that's an example of what inaccessibility looks like for users, and there are many, many more examples of that. So how can you make your fact checks more accessible? Well, here's a screenshot of twitter.com, and it's a tweet from TechCrunch, and it may not be immediately noticeable, but that embedded video in that tweet is inaccessible because it doesn't have captioning. And this is something that you'll see all the time, especially if you spend a lot of time on Twitter, that people upload, for example, clips from news footage or clips from TV shows or clips from podcasts, and they don't have captions in them. And that relies on you being able to hear that content to get full value from it. So if you can't hear that content, or if the content is muted, you won't be able to get full value from it. So this is an example of captioning just being a really, really important accessibility feature that's often overlooked, but it's really, really easy to fix. And I'll show you how. So this is a screenshot of a tweet from PesaCheck, which again is a fact-checking organization in Africa. And what we did is we took PesaCheck's fact checks and we repackaged them into multimedia content. And we did something really, really important, which is we made sure that that multimedia content was accessible to everyone by adding captioning, by adding subtitles. So in this screenshot here, there is an embedded video. And in the lower third of that embedded video is some text. And that text explains the audio that's playing in the background. So there is a waveform just behind that text, and that shows the user that somebody is speaking. But then the text below it lets them know what that person is saying. So you don't necessarily need to hear the video to understand what's happening. And this is an accessibility feature that's very, very easy to implement, and that I would recommend you doing, because there are platforms that don't enable closed captioning automatically. You know, if you upload a video onto YouTube, you can have closed captions automatically, but plenty of other platforms don't allow for that. So I'll show you how you can add your captions to videos like we did. So this is a process that we went through at PesaCheck. We used a mixture of free and paid tools. So for example, Anchor was free. So that's how we recorded our audio. And, Anchor allows you to record audio on your phone or on your laptop, and you can edit that audio and slice and dice it there and then export it as an audio file. We did the video in After Effects, which is a premium tool, but it's a tool that you can, if you're a fact-checking organization, you can get funding to get that tool for free. So I'd recommend that for any videos that you do use or do make. And I'll show you how to do that in the next slide. And then we used Kaplan.com to add captions. So Kaplan.com is a tool that it's a free website, and you just need to sign up with your email address. And once you do that, you can upload videos onto that website and then add captions either automatically or manually by typing them in, and then export the video with captions. So that's how we added our captions, completely free. It's very, very easy to do. And if you go to Kaplan.com, you can get started in less than a minute. So this is an example of an After Effects project. Like I mentioned, it's a really, really comprehensive tool, but it's not as daunting as it looks. I know it looks really, really complicated, but I'd be happy to share, my experience working with this tool. And it's a way that you can incorporate the audio and the video that you put together and just merge them in one project. And you'll see there at the bottom, like in the bottom third of this screenshot, there is, an audio file, and then there are the background images. And so you just combine them in this project and then export them. So that's how we did this. And, I'd be happy to answer any questions if you have questions on how to use After Effects with all the other free tools that I listed. And I'd be happy to show you. So that's basically the workflow that we used. And to conclude here, I'll just share some general accessibility tips that you can use for some of your other products that aren't videos. For example, adding alt text to your images, like I mentioned earlier. This is a text description of images that you upload onto Facebook or LinkedIn or Instagram or on your website itself. And it's very, very useful to just have 2 or 3 lines just describing the image for the benefit of users who are blind and who are navigating using a screen reader. It's also important to write at an approachable reading level, and that just doesn't benefit users with cognitive disabilities, but also users who aren't familiar with the language you're publishing in, or for whom that language is their second or third language. Writing at an approachable reading level makes your content more accessible for them. It's also important to use mixed case hashtags. So don't write your hashtags in all caps or in all lowercase, but use a mixed case, or sometimes known as camel case, which is where the first letter in each word of your hashtag is capitalized. And that helps users who struggle with distinguishing characters, or who are dyslexic, or who have low vision. It helps them distinguish the words in your hashtags better. So that's a way to make your content more accessible. And then finally, just use descriptive links. Describe the link rather than just embedding it. And it will help people know what they're clicking on, where they're navigating to, as well as for users who are using screen readers, it helps them navigate your content better. And it's easy to think of accessibility as adding more layers of work to your process, but a good way of looking at it is that accessibility should be complementary to the work that you do, and it contributes to your work being complete. So the work was incomplete before, as this user says, and it's not just adding more work to your workflow, but it's just making sure that every fact check that you produce, every bit of content that you put out is actually universally accessible. It's accessible to everyone, and that's really, really important. So again, here's a list of resources that you can use. I've already mentioned Kaplan. Color contrast is a way that you can check whether the typeface that you're using and the color combination that you're using are accessible. So that's really useful for users who are colorblind or for users with low vision. So if you're producing fact-checking infographics for your website or for Instagram, it's really, really important for you to test and see whether everyone can actually see them. And then I'd be happy to provide any of the other resources. There's the Universal Access Guide that we put together, which is a list of rules and guidelines that we use at Code for Africa, as well as the workflow that we used for PesaCheck, which is just a simple Google Doc that shows each step of the production process that we use to create that multimedia content that we put out. So I'd be happy to share this with you if you have any questions. So please do contact me. My details are on the screen. You can also find PesaCheck and Code for Africa on social media. Just search PesaCheck or Code for Africa and you should be able to find us. And yeah, thanks for giving me this opportunity. I'm really, really excited to engage with you more. And please let me know if you have any questions or comments. I'd be happy to answer them. So yeah. Thanks for your time.
So imagine that at the end of February 2020, when the almost whole world started planning the fight against the coronavirus, and many countries are establishing crisis teams, a renewed medical expert standing along with his fellow colleagues, and the president tells the public that this is the funniest virus in history. Now imagine that the same person a year and a half later says that pandemic is a conspiracy and that he does not believe in vaccines. Now imagine that that happens just after the investigative journalists have discovered that authorities manipulated the number of COVID-19 deaths, and that at the same moment, half of the population is hesitant regarding the vaccination. Unfortunately, you don't have to imagine all this, because Dr. Branimir Nestorović is a real good and real example of how official authorities, conspiracy theories, and the mainstream media are all together mixed up in Serbia and represent the lack of accountability for public speech.
Evo ova situacija sada, da li je po vama ovo neki globalni eksperiment?
Pa to je prilično jasno sad već. Mislim, ako je na početku možda nekom nije bilo sasvim jasno o čemu se radi, sad je potpuno jasno. Ispade na kraju ovi koji su takozvani teoretičari zavere, izgleda jedini znaju šta se događa. Mislim, u Americi je ispod 50% vakcinisanih još uvek.
If all Istinomer journalists and fact checkers are all the time checking the accuracy of the claims of this renewed children's pulmonologist, they would not be able to check even a tenth of what was said. Just his latest interview that included claims from the previous slides published on the YouTube channel of alternative online television received more than 1 million views, despite the fact that numerous of his statements have been proven to be false or misleading. The results of public opinion polls say that 28% of Serbian citizens trust him as a person who is not involved in politics. His popularity is also evidenced by many Facebook groups that are established to praise his personality. One of them is admirers of the character and work of Dr. Branimir Nestorović, which gathers almost 80,000 of members. So dozens of prescriptions for alternative medicines and posts with information opposed to the medical and scientific findings are published on a daily basis within these groups. Several other groups on the same social media gather additionally thousands of citizens. And due to the similar socio-political context, as well as the similar language, Nestorović's popularity and influence to spilled over into the countries of the region, such as Bosnia and Herzegovina, Croatia, and Montenegro. So in order to understand the context, it is necessary to explain that Serbia, which has a population of roughly 7 million, has made a meteoric start to its vaccination rollout. It was the second fastest in Europe, just behind the UK. At the beginning of this year, Serbia has been making headlines as an example of a country succeeding with its coronavirus vaccination campaign. So benefiting from its vaccine diplomacy, Serbia have the choice of 4 different vaccines. Chinese Sinopharm, Russia Sputnik V, Pfizer BioNTech, and AstraZeneca. But now, nine months later, despite the broad promotional campaign, only 50% of adult citizens decided to receive the vaccine, and hospitals again exceeded full capacity as a result of the high number of infected citizens with the serious symptoms. So how important is the influence of unaccountable but popular doctors on half of the citizens' decision to not get vaccinated?
Na kraju tamo piše da ne zna se efekat na fertilitet, na plodnost i na plod, je li tako? Zato što nisu završene studije na životinjama.
At the moment, these partly or completely false messages reach millions of people in Serbia and further the region. Nestorović is still perceived as a member of the government's official crisis team for the fight against the coronavirus. The consequences of these and many similar claims become noticeable this September when with the latest COVID wave with around 8,000 cases recorded daily, with estimates that this number can only grow. However, Branimir Nestorović is not the only one who misinforms the public under the title of doctor. After he stated for one tabloid in February this year that everything with the COVID-19 was invented, that testing as well as vaccination is worth nothing, and that none actually died from COVID-19, the Association of Health Workers sent a proposal to Doctors' Chamber of Serbia to initiate disciplinary proceedings against Nestorović, but to date there is no answer. Other doctors who loudly, mostly on social networks, present unfounded information and conspiracy theories also passed without any consequences, although charges were filed against them within the medical chamber for violating the code of medical ethics. So how all this started?
Mogu da verujem da narod koji je preživio sankcije, bombardovanje, svakojako maltretiranje će se uplašiti najsmešnijeg virusa u istoriji čovečanstva koji na Facebooku postoji. Ali stvarno nemojte da verujete neproverenim informacijama. Znači, apsolutno, epidemija u Kini je pri kraju, ljudi. Ona je počela 7. decembra, prvi slučaj je prijavljen. Već se zna da pada virulencija virusa, znači virus je sve slabiji i slabiji. Inače je slab. Evo žene, da kažem za žene, znači definitivno estrogeni štite žene, žene imaju jako blage oblike, praktično ne umiru od virusa, tako, ovoga novoga. Prema tome što se žena tiče, vi slobodno u shopping. U Italiju čujem da će sada bude veliki popusti, će tamo da budu, pošto niko živi neće dođe, jel tako, u Italiju. Prema tome muževe sad, malo pripremite, jel tako, vi to znate dobro mentalno. Šalim se, ali stvarno mislim da je, ne razumem, ja moram priznam, ja sam u početku bio zatečen kad je počeo ta priča počela, jer je virus bio smešan, mislim, znači, to je treća varijanta tog SARS-a, MERS-a, jel tako, koronavirusa, ovo je treća varijanta, on je najslabiji od sva tri. I prve dve su prošle nezapaženo, sad ova treća jednom je to neka, vidim, zatvaraju se granice, avioni ne lete, mislim, potpuna besmislica.
So he became known to the general public in February last year when, as a member of the crisis team at the first conference on the COVID-19 pandemic, he stated that the coronavirus is the funniest virus in history and that estrogen protects women from infection. He said that at the moment when the COVID-19 was spreading like a wildfire in Italy. The stated claim became even more significant after the president of Serbia, Aleksandar Vučić, stated that no one ever said that the COVID-19 was the funniest virus, which was immediately assessed by the Istinomer team as false. This president statement, our readers declared to be the lie of the year in Istinomer's traditional New Year pool. Since then, Nestorović has become a media star and avoidable TV character who is present everywhere, from morning programs and chatting after Sunday lunch, all the way to programs in the late hours. His Facebook profile is a source of information that is published in the most read daily newspapers and the most visited portals. But since the beginning of the epidemic, he has been a guest on televisions with national coverage and other mainstream televisions, which is especially important if we know that 2/3 of the Serbian citizens use television as the primary source of getting informed. Among other televisions with national coverage that host Nestorović on a regular basis is television Happy, which does that the most often. Regarding the audience data covering the period from January to May this year, 1.8 million people watch Happy TV on a daily basis. By a simple YouTube search, which includes the period from the beginning of 2020 until today, more than 250 videos with Branimir Nestorović's interviews, advices, shows, quotes, and so on can be found. Altogether, they received more than 18 million views. So, in addition to using his current statements as a relevant source, unaccountable media outlets, most often tabloids, also tend to recycle Nestorović's old claims. In addition to information about the coronavirus and the vaccines that are in focus, the range of topics has expanded. Pseudoscience, though through different variations, has remained in focus. For example, one of the tabloids with the biggest circulation in a desire for a sensation published Nestorović's old blog from 2017, in which he claims that the women's offspring are influenced by all sexual partners that she had. Istinomer most often dealt with this and other Nestorović similar misleading and false claims through the Facebook's third-party fact-checking program. And the positive impact of the fact-checking work that is done under this program was as well the fact that almost all mainstream media afterwards corrected the disputable articles that they published, including disinformation sourced by Nestorović about protective measures, vaccines and fertility connection, ivermectin, and similar. And as a part of this program, Istinomer checked the accuracy of Nestorović's claim on the effectiveness of ivermectin in the treatment of COVID-19 symptoms. which was published by the most widely read news portals in their printed and electronic forms. Since its publication, this Istinomer analysis proved to be among 5 long-tail articles this year. It has attracted a large number of readers after its publication, and still it is being read on a daily basis. So after it was recognized as an important topic for the Serbian audience, the Istinomer team decided to prepare a comprehensive dossier that will deal with all manipulative narratives and unfounded information that is widely shared in Serbia about this medicine. So this was a short presentation on the influence of unaccountable medical experts and media on the Serbian citizens' decision to not get vaccinated, and Istinomer's attempts to parry them with providing reliable and verified information. Also, of course, we would be happy to answer any questions you may have, and you can reach me at these emails.
Hello everyone, my name is Urvashi Kapoor. I am Associate Editor with Vishvas News, fact-checking unit of Jagran New Media, India. Here I'll be talking about how Vishvas News has spread awareness for COVID-19 vaccines under its media literacy program, Sach ke Sathi. Getting people motivated to take COVID-19 vaccine shots in some parts of India and across the world was proving to be a tough task for officials allegedly due to a range of misconceptions circulating about their side effects. It was the need of the hour to make people aware about how important it is to get the jab. Under the IFCN Vaccine Grant Program, Vishwas News started Sach ke Sathi Yes for Vaccine on May 24th and concluded the same on August 29, 2021. Sach ke Sathi is a Hindi slogan which in English means Truth Warriors. The Sach ke Sathi Yes for Vaccine campaign aimed at dispelling misconceptions about COVID vaccines among the general public and motivating them to get vaccinated. The program was conducted in the form of webinars with the help of a team of certified and trained fact-checkers, medical experts, fact champions, coordinators, presenters, support team. More than 36 specialist doctors across the nation joined the webinar and answered the queries of the attendees live. The webinars were conducted in 12 cities of 4 Indian states. The 4 states were Uttar Pradesh, Bihar, Jharkhand and Madhya Pradesh. Vishwas News also got support from local city coordinators, health reporters. The local doctors were arranged for each city so that they could relate the vaccine hesitancy in their city. Also, Vishwas News has a central pool of medical experts who were also present during the webinar. Coronavirus is a deadly virus that continues to afflict many countries worldwide, and you all know how important it is to get the vaccine. When we planned the vaccine awareness program, we created a dedicated process. We created a schedule for 10 city-wise webinars to be conducted in 3 rounds and 1 feedback round towards the end of the project. When we started the program, in the first round, we conducted webinars in 10 cities, namely Lucknow, Kanpur, Varanasi, Gorakhpur, Meerut, Patna, Muzaffarpur, Ranchi, Jamshedpur and Indore. After receiving tremendous response in the round 1 webinars, we decided to add 2 more cities in round 2, Agra and Bhopal. The total number of webinars after round 2 were 22. We selected top 5 champs per city after both the rounds, that is 10 champs per city, and further trained them in the third and final round of webinar. We clubbed round 1 and 2 and named the final round as feedback round. Towards the end of the webinar, we shared a PDF in which around 100 Q&As on COVID vaccination were printed with details of tools of basic fact checks. All the Q&As were answered by India's topmost health experts, medical scientists, doctors in exclusive interviews with Jagran. We first shared the PDF with all the attendees and asked them to check it and share with at least 100 people in their own social circle to provide them with verified information. Since all the attendees were connected with us in different city-focused WhatsApp groups, we asked them to share the screenshot as proof that they have shared the PDF with others in their circle with their names. After every session, we received superb responses from the attendees, and almost all of them shared the numbers and the PDF sharing screenshots with us. Top 5 attendees were selected on the basis of how many people they reached out and had spread awareness related to COVID vaccines. These top champs were called fact champions. Here you can see the consolidated data of the program details of what we targeted and what we achieved. We targeted webinars in 10 cities, but seeing the tremendous response, we increased 2 cities in round 2. In round 2, we conducted webinars in 12 cities. We planned 1,500 attendees in total, but again, we were able to make more and more people aware, and the total number of attendees by end of program were 2,265. WhatsApp engagement, that is second level reach, was planned to be 0.2 million in total, and we have achieved more than 0.4 million. Overall, we had a target to reach 1% of the total population by end of the project, which is 0.2 million. And by the end of the second round, we overachieved our targets by reaching out to more than 2% of total population of 10 cities. This brings the direct reach to 0.4 million. And if we add the social reach to it, which is a huge number, it sums up to approximately 37 million. Now, how did we calculate the reach? The direct reach was calculated on the basis of information shared by attendees in their social circle and PDF sharing through WhatsApp. Social reach was calculated on the basis that all the sessions were promoted on social channels of Vishvas News and Dainik Jagran, which has a combined reach of 20 million subscribers. The live links of the sessions were also promoted on Facebook pages of all the Jagran properties. The print ads and the news articles were published in Dainik Jagran newspaper and on online platforms. The podcasts of the sessions and the fact-check tips were broadcasted through community radio as well. Not only this, after the session, we shared the updated PDF as well as link of the fact-checking information through SMS and emailers. 0.12 million SMSs were sent, out of which 0.10 million got delivered. Information was also shared through WhatsApp messages. 35,000 messages were sent to users on alternate days, and around 0.45 million messages were sent in total. The first round was conducted from May 24th to June 14th. This is the schedule and bifurcation of numbers of first round of webinars city-wise, the number of registrations, number of attendees, and after every round of webinar, we shared PDF in WhatsApp groups where the attendees were added, and they shared the PDF in their circles. So this decides the second level reach. After the first round of webinar, the reach through WhatsApp was 0.26 million. The second round was conducted from June 18th to July 23rd. Similarly, this is the schedule and bifurcation of numbers of the second round of webinars city-wise, the number of registrations, number of attendees, and the reach. 0.18 million was the reach after round 2. The feedback round was conducted from August 2nd to August 29th. This was conducted for the selected fact champions from all 22 webinars conducted till the end of 2 rounds. Advanced level training sessions for all 110 selected fact champions were conducted, and they were made single point of contact and the representative of Vishvas News in their own cities. They were empowered with basic skills to further conduct fact check training sessions as and when required with the support of Vishvas News fact check trainers. We aim to reach 1% of the total population of these 10 cities by the end of project, which is 0.2 million people, and by the end of the third round, we had reached over 0.4 million, which is 2% of the total population of those 10 cities. In the feedback round, we also shared feedback forms with super champions, doctors, presenters, and coordinators. Their feedbacks were recorded, and the suggestions will be implemented for future training programs. Here you can see the compiled feedback received from doctors. Doctors found the program useful for mass education. Similarly, we received the feedbacks from super champs. They addressed that their misconceptions regarding vaccines got cleared. As per the feedback received from health reporters, doctors cleared the myths regarding vaccination. Also, the trainers shared certain suggestions for future awareness programs. Super champs who were trained in feedback round were asked to reach out to schools and colleges in their own cities and other communities to spread awareness for vaccines and to continue the battle against fake news. They are also sharing testimonials with us about the vaccine awareness programs and further trainings they are conducting among their social circles in order to spread awareness regarding COVID vaccines. After every webinar, the session got covered on Jagran website in story form. Podcasts were released after every webinar city-wise, where many people who couldn't join the webinar could hear what doctors and fact-checkers shared regarding vaccines. The webinar was also recorded and was shared in the form of short video on YouTube channels of Vishvas News, where people can watch the session later as well. The session was also widely covered in Jagran's newspaper. Through community radio programs, Sach ke Sathi was broadcasted in villages at regular intervals. We also created a dashboard where we tracked the performance and analyzed the data related to each session. The data was bifurcated city-wise, gender-wise, on the basis of age group, direct reach, social reach, videos, podcasts, etc. Well, I really enjoyed sharing about Vishvas News Sach ke Sathi Yes for Vaccine program. I would love to connect with you all to share more about Vishvas News and also answer any questions you have. Thank you.